Hello, this is a specimen of a gallbladder which has been cut open with the adjacent adherent liver. So let's turn it around to orientate ourselves. This is the liver, that's the cut section. This is the fundus of the gallbladder. And again, gallbladder, this is the serosa, and this is the liver. The main pathology is seen in the gallbladder wall, and we can see here that there is a tumor mass which is causing marked thickening of the wall of the gallbladder. The mass appears to be pale tan, fleshy, and there is a component that is protruding into the gallbladder lumen. I'm going to just sweep over this tumor with the magnifier, and we can see the tumor mass protruding into the lumen, invading into the wall of the gallbladder. And this is the part that also protrudes into the lumen, and here is the intramural part of the tumor. So the diagnosis here is carcinoma of the gallbladder. Whenever a diagnosis of malignancy is made, it is very important to assess prognostic features. So from this gross specimen, we are able to make an assessment of the local extent of the tumor. And this is an example of the TNM AJCC 8th edition staging parameters for gallbladder carcinoma. And if we look at some of the parameters, we can see that the depth of invasion of the wall is important, and also whether or not it penetrates the serosa and also invades into adjacent structures such as the liver or the gut. So let's go back and have a look at our specimen. If we focus on this area of the tumor, we can see that it is clearly invading into lamina propria. This brown layer is the muscularis propria. It is going beyond that, and this is the serosal surface. So what is more important is whether or not this tumor actually goes into the liver parenchyma. So let's turn this, and at this angle, this is the gallbladder wall. This is the cut surface of the liver that is adherent to the gallbladder. These whitish, ill-defined areas are actually tumor extending from the gallbladder into the liver parenchyma. And this is the resection margin of the liver. So clearly we can see that this tumor is extending beyond the gallbladder into the liver, and this is probably the reason why they resected the liver together with the gallbladder. So in our staging exercise, we can see that this would be at least PT3 stage. P stands for pathologic staging, so this means after pathologic examination grossly and also microscopically, that the tumor directly invades into the liver. So in summary, this is an example of a case of gallbladder carcinoma. We can see that there is an irregular fleshy tumor invading into the wall of the gallbladder as well as protruding into the lumen, and we can see that this tumor has extended contiguously into the liver.